Good evening, Professor Karl West here with the Academy of Lymphology, and the purpose of this video is to show a technique I call manual percussive constituent dispersal. The theory behind this is that we might disperse clots that are happening in the veins, a cerebral vascular incident, which is known as a clotting stroke. And I thought of this when I was trying to help my father after he had a stroke and been hospitalized. And the technique involves just tapping your skull on one side and then tapping the other side, but you're going to create a wave of percussion on one side and the other. You can actually create a epicenter on the left or right hemisphere, wherever you feel like the vascular incident is probably located. But anyway, the percussive force, tapping here and then here, I can do it in a rhythm, or I can do it in that offset way. I can create the epicenter where these waves of force collide. So the wave of force on one side will start, and then the other side will start a little bit later, and they'll collide over here. And now if I started it here, and it started coming across, and then I started it here, the force would probably collide somewhere over here. So the point is that you can sort of influence inside of this skull, which is, the brain is normally, you can't work on that. not without brain surgery. Well, this is one theory that we might, of a method that might be useful in preventing cerebral vascular incidents. And another thing it might be able to do, since we're theorizing and just using common sense, it may end up helping to dissolve plaques, amyloid plaques, and that sort of thing. It may help to free up clustered proteins and help the lymphatic system pull things out from the interstitial spaces in the brain. Now we know that lymphatic vessels are in the brain now, so we can talk about that. So normally I would just do it very quickly. That's kind of like a brain massage at that rate. How long do I do it? Not very long. Well, you could if you wanted to, probably. But I never needed to do it. Never felt it was. I just felt it was beneficial just for 10 seconds. Most I've ever done it. But if you had something coming on that felt like a stroke or anything like that, that would be, I think, a smart thing to do. Anyway, with that having been said, I will end the video and we'll make some more later. Thanks.